Hi, everyone. Welcome back to the StrokeSense podcast, where we explore breakthroughs in stroke care. I'm Sohail.
And I'm Soha. Today we're diving into an exciting topic, detecting strokes before patients even reach the hospital.
And joining us today is a very special guest, Dr. Wade Smith, Director of UCSF's Neurovascular Service. Dr. Smith, can you please tell us a little bit about your background and what first drew you to the field of neurology?
Sure. Thank you guys for having me on. It's an honor. I am a vascular neurologist and also a neurointensivist, which is a whole mouthful. But basically, I um, got into the field of neurology and neuroscience because of just a tremendous interest in the brain, how the brain works, how it works when in health, and how it works in disease. And as I joined the UCSF faculty back in 1994, I was very interested in stroke. Stroke just being a major illness that impacts so many people, young and old. And I had a degree in electrical engineering before I went to medical school. Very interested in circuitry and how maybe a computer someday could model how the brain works. So when I got into the field of neurology, it was fun for me to use engineering principles as well as clinical skills to try to solve problems.
Thank you for that incredible background. So let's talk about HeadPulse, a device you helped validate. How does it differ from traditional EMS assessments?
Sure. HeadPulse is a new biological phenomenon, or let me say it's newly discovered. It's been a biological phenomenon that no one's really found before. But basically, your head moves every time your heart beats. We call that the head pulse, like your peripheral pulse, like your radial pulse in your wrist or carotid pulse in your neck. This is actually the impact that the heart is having upon the actual biomechanical effects of the brain itself. So you send about basically a kilogram of blood to your head every minute. That's 2+ pounds of force that has to be dissipated. And we can measure that by putting very sensitive accelerometers actually on the skull of a patient or just on their scalp in a very light touch way. And that detects this, what we call a time varying pulse that goes basically like a heartbeat in your head. Um, so that was a new phenomenon that we reported 7 years ago. And uh, a colleague of mine and I got interested in, since I was interested in stroke, he said, well, why don't we look at this during stroke? And so we teed up with some good researchers that I worked with at UCSF, and we determined that actually this head pulse varies quite differently if you've suddenly had a major stroke. And when you're not having a stroke or you're having a thing that looks like a stroke that isn't a stroke, it doesn't change. So that really led us to the idea that maybe we could use this as a way to, in an ambulance, allow a paramedic to figure out whether you're having a major stroke that needs to be diverted to a specialty care center.
Wow, that's really fascinating. So, what have studies shown about its accuracy and speed?
It's fast. We did a couple different trials now in the pre-hospital world. So a paramedic puts it on the head of a suspected stroke patient, and that, based on neural network models that we use, some machine learning tools, we came up with a device that was about 80% sensitive and around 80% specific. So it's really accurate, and it detects a disease that's actually among all the patients a paramedic sees, which is a huge number. This is really truly a needle in the haystack. It can come up with a result in about 90 seconds, and it's important for speed because if you're going to treat a patient, you got to do it now. You don't want to delay things. And there's a lot of things that go in the process of treating a stroke patient that are time sensitive. So the longer you wait, the worse the outcome. So it's very important that this be quite fast and easy to use.
So, beyond HeadPulse, what are other technologies that are emerging for pre-hospital care?
There's a number of people that are interested in doing EEG recordings, so the electroencephalogram. In patients, we know that the EEG is altered when there's brain ischemia or lack of blood flow to the brain. So if you have the ability to measure the electrical activity that the brain is producing, then you can use that as a way to predict whether a person's having a stroke. Um, that's a challenge because it takes a little bit of time to get the thing on the person's head. And you don't want to delay things too much to get the patient in. There's another technique that's called transcranial Doppler. This is a technology where you send an ultrasound beam into the head and you record the Doppler shift from the red blood cells moving through vessels on the surface. And with expertise, you can tell if one of the major arteries is blocked or not. That also has a technological barrier to make it easy to use by people who aren't, trained technicians in ultrasonography. But and then there are other ways too. There's some advanced techniques using a very short wavelength radio frequency radiation that goes through the skull, non-ionizing radiation, so it's safe, that can measure changes in blood flow and blood volume. So it could be that a combination of these things, or maybe the head pulse stuff that we're doing is going to get the first in the field, and then hopefully with time, innovations can continue.
So, in the next few years, what role is AI going to play in stroke recognition, and what barriers remain to widespread adoption?
Great question. AI is very helpful for the purpose of taking a data set that has complex data and trying to make a transform of it. It's a classic thing called classification, normal, abnormal. And the machine learning techniques are very good at picking out stuff that your own eye might not. But I have to say, your eye is really pretty good. So the best connection is to take a prepared mind of looking for something along with these machine learning techniques to help you see it. And then the additional advantage, obviously, of the AI is that as you get more data, you can improve the detection of the algorithm. The downside of it is, interestingly, is that it's the way that the Food and Drug Administration approved devices is based upon a fairly complex process. And they're just trying to get their heads around how do we take devices which are constantly changing and still approve them for safety and efficacy. The process of applying for these things takes months and sometimes years. So if you're making an AI change tomorrow, you may not be able to implement it into clinical care for a couple of years. That's obviously way too slow. So the FDA is really pushing to try to understand this better and trying to make it more user friendly, if you will.
So, as these technologies evolve, how do you envision the role of paramedics changing?
Oh, I'm anticipating the greatest thing in paramedic history. I don't want to be hyperbolic, but these men and women are among the most dedicated people in the hospital in the chain of survival. They, in my opinion, are underpaid, but they're greatly appreciated by the individuals who have helped them. And so to give them a tool that actually tells them this is important, that you need to go from here to there to actually save this person's life or save their brain, gives them a power that they haven't had before. So I see a lot of pride in them rising, and I see this as an innovation that they've all wanted.
Looking ahead, what's the most exciting possibility in pre-hospital stroke care?
Well, I think what we're going to see, this is a prediction, but at least for the large vessel stroke patients, the patients who have really high morbidity and mortality, I anticipate that using our device or devices like it, that you'll be able to take a person from wherever they're found, at their office or at work or home, um, and directly transport them into a facility that can do the intervention that's needed. This is something we've done for heart attack victims now for years. It's called STEMI, STEMI, for ST elevation MI. And for that, basically, the paramedics took an EKG machine and enough leads on it that they could detect an ST elevation MI in the field. And they said, okay, if that's what we're having, we're going to the hospital that can actually put a catheter into this person's heart and fix them, right? That was a long time ago. So it transformed the paramedic's ability to say, yeah, guy's got chest pain and I think he might be having a heart attack. And you bring him to a hospital that can't do that procedure. That changed. This is what's going to happen to stroke too. So we're going to be able to say, you are one of the 13% who has one of these strokes that needs to have a catheter used. We're going to go directly to that lab. So the device has to be good enough to detect things and have a very good negative predictive value. So you're not treating patients who don't need it. And when that happens, we're going to be able to take patients who otherwise would be disabled for the rest of their life, starting at whatever age they had the stroke, and they'll walk home in 2 days. That's the vision of the future.
And lastly, for our listeners who want to support these advances in stroke prevention, what can they do?
There are lots of things that people can do, but probably one of the best things is to be educated about stroke signs and symptoms. FAST, F-A-S-T is an that's fast to remember. So facial weakness. If one side of the face is down compared to the other, that could be a stroke. Often they have problems with their speech, which is the S part. They can't speak right or their words are slurred. Um, Arm weakness. So if they hold up their arms, can they hold their arms up and one falls when they try to keep them up, or do they stay in that position? So face, arm, speech, and then T is time, knowing that time is of the essence. This isn't something that you say, okay, just go back to sleep, go to bed, sleep it off, you'll feel better in the morning. If you do that, there's no time to intervene. Neurons die at about a million per minute in this process. So in order to save that brain tissue, you have to work quickly. So FAST.
Dr. Smith, this conversation has been very insightful. Thank you for sharing your vision for the future of stroke care.
And thank you to all of you for listening in. Remember, the fight against stroke starts long before the hospital doors.